Friends, I am Dr. Sachin MUTHA. Today let us study the classification of antipsychotic drugs. First of all, where the antipsychotic drugs are used. It is mostly used in schizophrenia. So what is schizophrenia? Schizophrenia is a mental impairment of BET, that is the mental impairment of the behavior, emotion, thought, and due to which there is a decrease in the economical, social, occupational, personality development, and which may affect his family life. And if treated properly by antipsychotic medicine, he can live a proper and smooth and peaceful life. Now, what are the types of schizophrenia? The types of schizophrenia, I have made a mnemonic, that is pedicure. For P, that is paranoid. For D, that is disoriented. Then for C, that is your catatonic. Then for U, that is your undifferentiated. And for R, that is residual. These are the types of schizophrenia. What are the complications of the schizophrenia? The complication of the schizophrenia, that is the mnemonic which I have made here, that is CASH. For C, that is catatropic stupor. Then for A, that is your agitative behavior. Then for S, that is suicidal tendency. And for H, that is homicidal tendency. These are, in short, I have prepared the mnemonic for the complication. Now let us study what is the treatment of schizophrenia. Treatment of schizophrenia, I have made a mnemonic, that is SPECS. S, that is sedative drugs. For P, that is antipsychotic drugs. Then for ECT, that is the electroconvulsive therapy. Then for C, that is your counseling. And for T, that is the management of the complication or the emergency management of the complication created by these antipsychotic drugs. And here a very well known example, that is Neuroleptic Malignant Syndrome, where the signs and symptoms of the Neuroleptic Malignant Syndrome, I made a mnemonic, that is FORD. F for fever, O for output of the urine output is reduced, R for rigidity, and D for disorientation. And the treatment for the Neuroleptic Malignant Syndrome, that is dantrolene, and to reduce the medicine or the dosage of the antipsychotic drugs. This is all in short of the schizophrenia. Now let us study the classification of antipsychotic drugs. For the classification of antipsychotic drugs, I have made a mnemonic, that people please take bath. For the people, that is phenothiazine. Then for take, that is thioxanthine derivative. Then for B, that is butyrphenone. Then for A, that is atypical psychotic medicines. And for H, that is heterocyclic compounds. This is in short the classification of the antipsychotic drugs. Now let us study one by one. For the phenothiazine derivative, that is we have made the mnemonic, that is people. For the phenothiazine derivative, there is again I have made a mnemonic, that is all people please. All, that is aliphatic side chain. Then for people, that is piperidine derivative. And for again people, that is your piperazine derivative. For aliphatic side chain, here there are two examples, that is your chloropromazine and trifluoropromazine. Then for piperidine, that is the very well known example, that is your thioridazine. Then for the piperazine, again I have made a mnemonic, that is flute. For flu, that is your fluphenazine. And for T, that is your trifluoroperazine. Then people please take for this thioxanthine. For the thioxanthine, the very well known example which we use mostly in our clinic, that is your flupentixol. Then people take bath. For B, that is your butyrphenone. For the butyrphenone, again I have made a mnemonic, that is your BPTH. For B, that is your butyrphenone. Then for P, that is your penfluridol. Then for T, that is your trifluoroperidol. And for H, that is your haloperidol. Then for the BAT, for the atypical antipsychotic medicine, I have made a mnemonic, that is your chorus. For C, that is clozapine. Then for O, that is olanzapine. For R, that is risperidone. Then for A, that is your amyl sulfide or amiprazole. And for T, chorus. For S, that is seroquel or Certindel. This is all the atypical types. And for the BATH, that is your heterocyclic. And for heterocyclic, I have made a mnemonic, that is HELP. H, that is HE, that is heterocyclic. For L, that is loxapine. Then for again L, that is leosulfide. And for P, that is your pimozide. This is in short all the classification of the antipsychotic drugs. Also remember, due to the antipsychotic drugs, mostly we can see the extrapyramidal symptom, that is EPS. And for the EPS, if we can see the EPS due to this medicine, and therefore the atypical medicines were discovered. And mostly due to the typical antipsychotic medicine, EPS is seen, and which should be avoided by proper treatment. Now let us study the MCQs. The first MCQ, what are the sign and symptoms of EPS? First, that is pseudoparkinsonism, then acute dyskinesia, then akathisia or tardive dyskinesia, and fifth, all of the above. Yes, the answer is all of the above. In the EPS, that is extrapyramidal syndrome, we can see that is pseudoparkinsonism, then acute dystonia, then akathisia and tardive dyskinesia. Then second MCQ, what is rabbit syndrome seen in EPS? First, acute dystonia, second, pseudoparkinsonism, third, akathisia, and fourth, tardive dyskinesia. Yes, rabbit syndrome is seen in pseudoparkinsonism. The third MCQ, what is dibenzoperoxide derivative? Loxapine, clozapine, olanzapine, haloperidol. Yes, the correct answer is the dibenzoxide derivative, that is loxapine, which is we also call it heterocyclic compound. The fourth MCQ, EPS is not seen by aliphatic compound, then thioxanthine, butyrphenone, fourth, atypical antipsychotic medicine. Yes, the correct answer is atypical antipsychotic medicine. Next MCQ, reserved drug for the resistant schizophrenia? Clozapine, olanzapine, sertraline, haloperidol. Yes, the correct answer is clozapine. The next MCQ, neuroleptic malignant syndrome is treated by first, prednisolone, second, methylprednisolone, third, haloperidol, fourth, dantrolene. Yes, the correct answer is dantrolene. The next MCQ, side effect of phenothiazine. What is the side effect of phenothiazine? First, alopecia, second, jaundice, third, anemia, fourth, glossitis. Yes, the correct answer is jaundice. The next MCQ, where we can see chewing motion, in EPS. The first one is pseudoparkinsonism, the second one is acute dystonia, the third one is akathisia, and the fourth one is tardive dyskinesia. Yes, the correct answer is we can see the chewing motion in, yes, anyone can guess? We can see the chewing motion in tardive dyskinesia, because in acute dystonia we can see there is a grueling of the facial grueling is there. Then in pseudoparkinsonism we can see there is a peeling or rolling of the hands. Then in acute dystonia we can see there is a anxiety, and in tardive dyskinesia we can see there is a chewing motion. Hope you like this mnemonics and classification. For more mnemonics and classification, like and subscribe my channel. Thank you.